Thanks, Nicole. Well, it's almost Medicare annual enrollment time, the critical 10-week window when eligible people can change their plans. While many people let their coverage renew automatically, comparing options could potentially save some people money on things like their prescriptions. And it's important to do your research. So here with some tips on how to simplify this process, we have John Woods with Insurance Navigators. John, thank you for joining me this morning.
Thanks for having me.
Of course. So for our viewers, can you just tell us what is the Medicare annual enrollment period, and why is it important for people to understand it?
So on an annual basis, the plans start January 1st, so you need to learn about them ahead of time. So Medicare sets this rule between October 1st is when we can start talking about the changes for next year, but you have to enroll between October 15th and December 7th. And there are plan changes, actually some pretty big ones this year.
Can you talk about some of those big changes?
Sure. There's two categories of plans. There's people that have original Medicare and a supplement along with a drug plan. For those, there's two key points there, probably three actually. One is that supplement costs have gone up significantly the last 2 years. And there's some companies that are more competitive now that have entered the market that we're starting to use, but you still have to remain healthy. Yep, there is medical underwriting. Second thing is Medicare is adding some prior authorizations that have never been there before. Their fraud, waste, and abuse division came up with 17 procedures or services that they're monitoring. And Ohio, of course, is on the pilot program. The third thing then, of course, is your drug plan. And that's where the biggest change is. So what I've seen in the last couple of weeks is people that are taking a lot of generics, not any real negative impact. But if you're on a name brand drug, and especially if you're on two name brand drugs, definitely get a review, because you're probably going to, well, you at least have to know what's going on, if not change a plan.
What are some things that people can do to kind of have a stress-free enrollment period?
The best thing would be go into it prepared. So if you're going to talk to somebody like me, have a list of your doctors, especially the list of your drugs, because there are a lot of tools out there we can use to compare the plans. So getting that to us, in fact, I like to get it before I sit down with you just because it's more efficient. I can do that kind of work at night.
What can people look at to maybe save some money on things like their prescriptions?
Ironically, and maybe it's not ironic, I think the single best thing is like GoodRx, or there's some local pharmacies. I hear from my clients, Giant Eagle, Sam's Club, that they have their own in-house programs that are sometimes cheaper than your drug plan. That actually has been going on for at least 10 years, so we try to tell everybody about that.
Why is it important for people to review their coverage annually? Some things, you kind of mentioned it, but some things change often.
Right.
You might want better coverage. What are some things that people should consider?
Well, the biggest change this year is in what's called the Medicare Advantage plans, and that's 90% of the marketing on TV, the phone calls. You're not supposed to get that whole thing. And I've always described Advantage plans this way. They all live in the same neighborhood, and it's a nice neighborhood. Maybe some of the houses are a little bigger, but in 2026, it's the same neighborhood, but the houses for some of them have gotten a little smaller, and they're closer together. So the plans are kind of clumping together, and the biggest difference between plans going forward is actually on the drug side. So that's the most important thing, is to compare drugs.
And as you know, we're in the middle of a government shutdown. Is that something that could impact people's Medicare, or should they not be worried about that?
I wouldn't be too worried about it. I mean, eventually they work these things out. In Medicare, the services itself and that sort of thing are kind of like in stone. So the funding for it, I wouldn't worry about that at all. Now, there may not be enough people to service it, but as far as the coverage goes itself, I wouldn't be too concerned.
Okay, a lot of good tips there, John. Thank you so much.
Thank you.
Of
Appreciate
course.
it.
All right, WFMJ Weekend Today will be right back after this break.